Hello, welcome to any community. In this particular video, we are going to discuss one of the very important topic as far as the learning of the subject of Roga Nidana is concerned. That is, how to identify the Nidana, how to frame out the Samprapti. When you think about the identification Nidana and Samprapti, first of all, we need to know about the what are the possible sources of entry of this nidana, or what we can say the pathogen, into the human body. To know about this, so more than 95% of the occasions, in cases of the nija vikara, wherein the entry of pathogens will be taking place through the oral cavity. That is the reason we have to be very careful to identify this particular, explore this particular, what do you say, that the source of the entry of the pathogen, which is having the direct link with the alimentary canal. And when you think about the alimentary canal, it is the same passage which will be helpful in the, what do you say, that entry of the food substances, which will be converted into usable micromolecules from the uh, non-utilizable macromolecules. So that means, so the entry of the pathogens will be taking place in case of the Nija Vikara, where vitiation of the dosha will be taking place. That will be happening in the alimentary canal. So when that will be moving to the periphery as such, or that will be moving into the cells as such. To know about it, we have to know about the mechanism of movement of the food substances from the alimentary canal to the cells. When a person is going to consume the food substances, so that will be taken through the oral cavity, wherein the mastication, etc., will be done, wherein the salivary juice, etc., that will be getting mixed with the ingested or the food, wherein the macromolecules are getting converted into intermediate molecules as such. This will be swallowed. That means in the mouth, this particular food substances that may remain for a period of 2 minutes or so. So then, after swallowing, the food will be entering into the stomach within seconds. In the esophagus, the transport, what we can say, the gut transit as such, that means the transport of the food substances will be happening within seconds. Here, the esophagus will be functioning as the transport medium plus protective medium from the substances. In the stomach, the food will be remaining for a period of 2 hours. So, wherein the macromolecules are going to get converted into intermediate molecules or micromolecules in the presence of hydrochloric acid and in the presence of the gastric juice. And the mucus which is being secreted in the stomach, so that will be responsible for the, again, protective mechanism of the stomach wall. So after a matter of 2 hours later, the food will be start entering into the duodenum. So which will be either macromolecules or intermediate molecules, so which will be getting entered into the small intestine in the duodenum first, then jejunum, then ileum. There the food will be remaining for a period of 6 hours. In this particular duration of time, the conversion of macromolecules into the intermediate molecules, then into the micromolecules, that will be happening. And after this particular micromolecules as such, that will be getting assimilated in the small intestine. So nearly after that particular 6 hours of the food present in the small intestine, that will be entering into the large intestine, wherein the food will remain for a period of 24 to 48 hours. Later, this will be responsible for the absorption of water and electrolytes, etc., from the large intestine, and that will be entering into the capillaries. So the micromolecules formed in the either in the stomach or small intestine or large intestine. So that will be entering into the capillaries, and from there it will be entering into the portal circulation, then to liver, then to heart, then to inferior vena cava, then to heart, then to aorta, then to the arteries, and then to the capillaries. From the capillaries, these nutrients, micronutrients or micromolecules, will be entering into the interstitial compartment or interstitial cell spaces. From there, these nutrients or micromolecules will be entering into the cells. So, whereas the fat molecules which are being absorbed from this alimentary canal, that takes a different course. So that is entering via lymphatics into the thoracic duct, then into the superior vena cava, then into the heart, later into the aorta, and later into the arteries and capillaries. In that way, the movement of these nutrients that will be happening. In the same way, the pathogens which are entering through the mouth, so that will be entering in the same manner. But here they are responsible for the inflammation to happen in the stomach or small intestine, large intestine. So because of the inflammatory process, the macromolecules present in the stomach or small intestine, large intestine, that are not going to get converted into micromolecules. In that particular situation, the macromolecules which are being present, they enter as macromolecules only into the capillaries of stomach or small intestine, large intestine. These macromolecules, after the absorption, they enter into the lymphatics. From the lymphatics, they are entering into the thoracic duct, then into the superior vena cava, then into the heart, then into the arteries, then into the capillaries. From the capillaries, they are entering into the interstitial compartment. From the interstitial compartment, these pathogens will be entering into the cells. This is how the pathogens, they are entering from the alimentary canal into the cells as such. When you think about the understanding of Nidana as such and Samprapti, you are supposed to know about the fundamentals of Kriya and fundamentals of Roga Nidana. To know about it, you need to know about the identifying the Nidana entry into the human body. That means from the exterior into the body. They are going to happen either through the natural orifices or through the trauma to the skin, etc. And as well as there may be a possibility of entry of these Nidana or pathogens into the Abhyantara Srotas also. So that the second factor that will be determining the Samprapti or Nidana analysis as that is number of pathogens entering into the human body. Lesser number of the pathogens, less severe disease. More number of the pathogens, more severe disease may happen in the human body. Third factor that is going to determine, that is the virulence of the pathogens entering into the human body. That is less virulent pathogen, milder form of disease. More virulence of pathogen, more severe form of the disease will be manifested in the human body. As we have discussed here, the movement of the pathogens that can happen from the alimentary canal into the intravascular compartment, from the intravascular compartment into the interstitial compartment, from the interstitial compartment to intracellular compartment. All these are responsible for the typical clinical manifestation. For example, when the person is having the entry of pathogen from the alimentary canal into the intravascular compartment, the person may show only the symptoms related to intravascular compartment itself. For example, the presence of fever, etc. Whereas the person who is having the entry of pathogens is happening into the interstitial compartment. So, for example, if the person is doing the more amount of the running, etc., then the pathogens which are present in the blood vessels, they are more concentrated upon the lower limb. So like that, the clinical symptoms are pertaining to lower limb are going to get manifested. Further, if the pathogens are entering into the cells, we are going to see the cellular changes as such. So, why we need to know about this particular phenomenon is to plan the line of treatment. Suppose if the pathogens are present in the cell, that has to be brought into the interstitial compartment. From there, that has to be brought into the intravascular compartment. From there, that has to be brought into the alimentary canal. Later, that has to be get eliminated to the exterior, either by Vamana or emesis, or by Virechana or purgation, or by Basti or medicated enema therapy. So, suppose if the pathogens are present in the interstitial compartment, not in the intracellular compartment. In that particular situation, we are making to move these pathogens into the intravascular compartment. From there, it has to be brought into the alimentary canal. Later, that has to be brought into the exterior by either Vamana, Virechana, or Basti. If the pathogens are present in the intravascular compartment, not in the interstitial or intracellular compartment, in that particular situation, we are going to make the movement of these pathogens into the alimentary canal or GAIT or gastrointestinal tract. From that, that has to be eliminated to the exterior by Vamana, Virechana, or Basti. Suppose if the pathogens are present in the only in the alimentary canal, that has to be eliminated to the exterior either by Vamana, Virechana, or Basti. Suppose if the person is having the pathogen only in the localized region, for example, in the finger, skin as such, we are going to do the Rakta Mokshana. So that is locally we are going to do the bloodletting. Thereby, that is going to get this elimination of the pathogens will be done through that particular way to the exterior. And if the person is not willing to go for the panchakarma or shodhana therapy or purificatory therapy, then we are going to plan the shamana therapy. This is what is the main fundamentals of chikitsa that will be done whenever if you are looking into the line of the what do you say that the chikitsa as such. For that, you should be well versed in Kriya Sharira, which is helpful in becoming the expert of Roga Nidana. And later, so if you are becoming the expert of the Roga Nidana, then we are going to become the experts of Kaya Chikitsa. So, for this, you should be well versed in understanding the Srotas. So, you should be well versed in understanding the Bahya Srotas and Abhyantara Srotas. So, for that, you should be in a better position to identify what are the impacts of these Bahya Srotas, which are 9 are present in the males and 12 are present in the females. The detailed description will be dealt in the coming slide. Whereas Abhyantara Srotas, they are 13 in number as per Charaka as such. And the main function of this particular Srotas is Sravana. The term Sravana refers to the movement of the any kind of the substance from one place to the other, maybe in the form of either diffusion or maybe in the form of either simple motion itself, or either there may be a possibility of osmosis, or there may be a possibility of permeation or oozing, etc. So, in a sense, the functions of the Srotas are most commonly applicable to the functions of the capillary. For this, you should be knowing about the decode the Srotas first. So, suppose this is an imaginary Srotas which is having the organs 1, 2, 3, 4, and 5, which is having the Srotomula as Srotomula A and Srotomula B. And the normal movement in this particular occasion is happening from Srotomula A to Srotomula B. So that means if at all any kind of the nutrients are entering from Srotomula A, a substance is entering, then that will be moving to Srotomula B, which is passing from organ number 1, 2, 3, 4, and 5. Suppose if the pathogen is entering from the Srotomula A, then so the symptoms as such that is going to produce that will be observed in the organ number 1 first. Later, the symptoms will be observed in organ number 2, then to organ number 3, then to organ number 4, then to organ number 5. And later, Srotomula B affliction can also be seen. Because here the movement of the Srotas, movement in the Srota is happening from Srotomula A to Srotomula B. Suppose if the pathogens are entering at the Srotomula B, and we are going to observe the movement of the in the Srota is happening from Srotomula A to Srotomula B. So here the Lakshanas will be observed only in the organ number 5, whereas organ number 4, 3, 2 and 1, the symptoms may be less likely be produced. Suppose if there is the entry of pathogen is happening in the Srotomula, in the organ number 3. In that particular situation, as the movement of the substance is happening from Srotomula A to B, the symptoms can be observed initially in organ number 3. Then we are going to observe the symptoms in organ number 4, and then we are going to observe the symptoms in the organ number 5. Whereas the symptoms in the 2 and 1 are less likely because the movement is happening from 3, 4 to 5 in this particular example. Suppose, to summarize this, if the pathogen entry is happening in the organ, in the Srotas AB, if the pathogen entry is happening at the A end, then symptoms can be observed in 1, 2, 3, 4 and 5. That can happen in due course of time. Suppose if the pathogens are present in the Srotomula B of the AB Srotas, then symptoms may be pertaining to organ number 5 only. Whereas organ number 4, 3, 2 and 1, they are less likely to get disturbed. Suppose if the pathogens are entering at the organ number 3 level, then symptoms may be observed in 3, 4 and 5, whereas organ number 2 and 1 are less likely to get disturbed. For this, you should be in a better position to understand the concentration of the blood in the circulatory system. When you think about the blood as 100% in the circulatory system, 91% of the blood will be present in the systemic circulation, and 9% of the blood will be present in the pulmonary circulation. Among this 91% of the systemic circulation, 7% of the blood will be present inside the heart, and 13% of the blood will be present in the arteries, and 7% of the blood is present in the arterioles and capillaries, and 64% of the blood will be present in the veins, venules and venous sinuses. So that means the more and more blood is situated in the veins and venules only. And adult human body is composed of 10 billions of capillaries on an average. Further, as far as the movement of the blood is happening in the circulatory system, nearly around 70 to 80 beats per minute may be movement of the blood will be happening in the aorta, whereas the movement of the blood in the capillaries may happen once or twice or thrice per minute only. As far as the movement of the blood in the capillaries are concerned, they will be happening up to 0.3 mm per second. To summarize the Srotas and capillaries, Srotas can be a minutest structure, or it can be a huge visible tubular or meshwork-like or oval structure, which is responsible for the transport of the substances from one place to other, maybe either simple motion, or maybe either in the form of diffusion, or maybe osmosis, or maybe in the form of permeation or the oozing, etc. So the human body is composed of 10 billion capillaries, 0.3 mm per second will be the speed of the movement of the blood in the capillaries, and movement of the blood is happening in the capillaries up to once or twice or 3 times per minute normally. As far as Nidana identification is concerned, which is the main topic of discussion today, so 9 orifices, natural orifices are being present in the males, and 12 natural orifices are present in the females. So whenever the Nidana or pathogen are entering in any of these natural orifices, initially the symptoms may be observed in those natural orifices. For example, if the pathogens are entering in the oral cavity, initial symptoms are observed in the oral cavity. If the pathogens are present entering via anus, initial symptoms are observed in the anus. If the pathogens are entering into the vagina, initial symptoms are observed in the vagina. If the pathogens are entering into the ears, initial symptoms are observed in the ears. If the pathogens are entering into the nose, initial symptoms are observed in the nose, such as sneezing or nasal blockage or nasal discharge, running nose, etc. If the pathogens are observed entry into the eyes, initial symptoms are observed in the eyes. In this way, initial symptoms are observed in the area where the entry of the pathogens are going to take place. Hence, the duration of the presenting complaint is of much importance. And as far as impact of the Nidana, type of Nidana on the human body. Suppose if the person is a runner and he is going to do the running after taking the somewhat a heavy meal as such, then there may be a possibility of the pathogens, if at all if they are formed, they are mainly concentrating upon the movement of these pathogens are going to happen in the lower limbs. Or if the person is doing the wrestling in the upper hand itself, then the pathogens they are start entering from the alimentary canal into the upper limb only, because the excessive movement of the human body, the blood circulation will be increasing on that particular part of the body. That is the reason. So impact of the Nidana, that will be of high importance as far as the type of the Nidana is concerned. As far as the Samprapti identification is concerned, in case of the Nidana, Nija Vikara, wherein the dosha vitiation is first observed and later there will be symptom manifestations, here the pathogens will be start entering from the alimentary canal, that too from the stomach or small intestine or large intestine. From there, these pathogens will be entering into the intravascular compartment. From the intravascular compartment, these pathogens will be entering into the interstitial compartment. From the interstitial compartment, these pathogens will be moving into the intracellular compartment. So that means from the alimentary canal till the cells, there will be the possibility of the movement of the pathogens. So for this, you should be in a better position to know about the principles of Vyadhi Vinischaya. So that means the Ayurveda says, Tasmad Vikara Prakritihi Adhishtana Antaranija Samuthana Viheshamsha Bhutva Karmam Samachare. So here this highlights the importance of Nidana understanding and Samprapti understanding. So Vikara Prakriti, the first and foremost point. So we have to identify which is the dosha afflicted. Whenever if you are observing Karshya Kashnoshna Kamitva Kampana Shakrit Grahan Balanidrendriya Bhamsha Pralapa Brahmadinata, we are going to say there may be a possibility of a Vata dosha dominance. Then the Pita Vinmutra Netratva Kshutra Dahalpa Nidrataha Pittam, we are going to say there may be a possibility of a Pitta dosha affliction. Then the Shleshma Agni Sadana Prasekalasya Gauravam Shwaitya Shaitya Shatangatvam Shwasaka Sati Nidrataha, there may be a possibility of kapha dosha vitiation. So like that, we should be in a better position to identify which particular dosha is increased in the human body. Further, dushya affliction. Suppose if you are observing the adjastyadi dantamshya, we are going to say there may be a possibility of a asthi dhatu affliction. Majja netranga gauravam parvasu sthula mulani kuryat krishranya arumshacha. We are going to say there may be a possibility of majja affliction in the human body. रक्तं विसर्पप्लीह विद्रधिं कुष्ठमातास्त्र पित्तास्त्र गुल्मोपकुशकामलाः व्यङ्गाग्निनाश सम्मोह रक्तत्वं नेत्रमूत्रताः. We are going to say there may be a possibility of the rakta dhatu affliction. अश्रद्धा चारुच्यश्चायस्वैरस्य मर्सज्ञता हृल्लासो गौरवं तन्द्र साङ्गमर्दो ज्वरस्तमः पाण्डुत्वं स्रोतसाम्रोधः क्लैब्यं साधः कृशाङ्गता नाशोग्ने रयथा कालं वलयः फलितानि च. रसधातु affliction can be predicted. Further, srotas affliction. Which particular srotas is being afflicted? For example, the adhimamsarbudam kilam galashalo kushundike puti mamsala jiganda gandamalo pajihvikaha. Mamsava srotas affliction is being predicted. Agni affliction. Which particular Agni is afflicted? Whether it is Jatharagni or Dhatpagni or Bhutagni. Which particular Ama is involved in the body? Whether it is Jatharagni Janya Ama or Dhatpagni Janya Ama or Bhutagni Janya Ama. So that has to be analyzed while looking into the Vikara Prakriti. The second point, that is Adhishtana Antara. So that means which particular site of the body is being afflicted, which particular Shadanga is being afflicted, whether is it upper limb or whether is it lower limb or whether is it the Udara or whether is it Uras or whether is it Urdhvanga. Affliction is there, that has to be noted. Which particular part of the body, whether the person is have any particular localized lesion, whether is it in the proximal interphalangeal joint or whether is it in the wrist joint or whether is it in the only skin is being afflicted or whether is it any kind of the muscle is being afflicted or whether is it any joint is being afflicted, that has to be noted. Which particular Roga Marga is affected, whether it is Abhyantara Roga Marga is affected or whether is it Bahya Roga Marga is affected or whether is it Madhyama Roga Marga is affected, that has to be noted. The third point I said, that is Samutthana Vishesha. Any particular specific Nidana involved, that has to be noted. Vyayamad, apatarpanat, prapatanat, bhangat, kshayat, jagarat, veganam ch vidharanat, atishya ityad atitrasatah, rukshakshobakashatikta katukerebih prakopam rajit, vaidharagame parinatejanya aparanya vicha, which may indicate vata dosha affliction. Tattam losha vidahi tikshna lavana krodho pavasa tapastri samparkatilatasi, tadisura shiktara naladibhi, mukte jirete bhojane cha sharadi grishmiti pranina madhyane tata ardharat samay pittam prakopam rajit. Pathodosha affliction can be predicted. Then Guru Madhura Sath Snigda Duktheksh Bakshit Dravadati Dinanidra Upa Sarpish Prapure Tuhina Patana Kale Klishmana Samprakopa Prabhoti Divasadav Uktamatre Vasante. This may imply the affliction of Kapadosha vitiation. That has to be identified. Guna increased in the human body. Which particular guna is increased in the human body? Whether is it Ruksha guna is increased or whether is it Lagu guna is increased or whether is Shita guna is increased or whether it is Picchala guna is increased or whether it is Snigdha guna is increased or whether it is Ushna guna is increased. So like that, which particular guna increased in the body has to be noted. Regarding the vihara done by the patient. For example, if the person is doing the vyayama, for example, if the person is doing the vyayama for 5 minutes, the vata dosha vitiation may be milder. For example, 10% of the vata dosha may be increased in the body. Suppose if the person is doing 1 hour of vyayama, the vata dosha may be increased up to 40% or so. If the person is doing more than 3 or 4 hours of vyayama as such, then there may be a possibility of vata dosha increase up to 50% or more than that. So like that, so what kind of the vihara is being done by the person, that will be deciding the actual dosha, that is the nidana, and its impact in the human body can be predicted. Let us take another example regarding the adhyasana itself. So suppose if the person is doing katu rasa sevana, so then in that particular situation there may be a possibility of either vata or pitta dosha increase. Suppose if the person is doing the katu rasa as well as amla rasa sevana, both are in the 40 percentage, in that particular situation it is not the vata dosha prakopa may be possible, it is the pitta dosha may be increased to the maximum extent, then there may be a possibility of vata dosha vitiation. Because this katu rasa is responsible for the increase of the Katu, that is the Vata as well as Pitta dosha more. Suppose if the person is consuming more amount of the Madhura Rasa Sevana, then there may be a possibility of increase of the maximum Kava dosha Prakopa. Suppose if the person is consuming Lavana Rasa in up to, for example, the 30% as such, and Madhura Rasa up to 20%, Katu Rasa up to 50% as such, then we may have the increase of Pitta dosha more, whereas then there may be a possibility of increase of Vata dosha, then there may be a possibility of increase of Kapha dosha. So like that, so we are going to predict the Samuthana Vishesha in the person as such. So this is about the Ayurvedic interpretation. Then, whenever we are going to identify these pathogens entry, then we have to identify what about the localization of these particular pathogens. Whether the pathogens are localized in the mouth, in case of the poor oral hygiene, pathogens are may be localized in the mouth. Or otherwise, is there any pathogens are entering localized in the stomach? Or whether the pathogens are localized in the small intestine, or whether the pathogens are localized in the large intestine, or whether the pathogens are localized in the lymphatic system, or the pathogens are localized in the heart, or the pathogens are localized in the arteries, or the pathogens are localized in the capillaries, or the pathogens are localized in the intestinal compartment of any particular part of the body, or whether the pathogens are localized in the cells. So based on that, the person may have typical symptoms get manifested. For example, if the person is having the pain in the knee joint, left knee joint, so that means there may be a possibility of the cells afflicted in the left knee joint. So that means intracellular compartment of the left knee joint is being afflicted there. So that means your main aim should be to have the removal of these particular pathogens from that particular part. So if it is widespread in the affliction, that has to be transported into the intestinal compartment, then that has to be brought into the intravascular compartment, then that has to be brought into the alimentary canal, then that has to be get eliminated from the Vamana Virechana or Basti. In that way, the localization of the pathogens will be helpful in the what do you say that the planning the line of treatment, planning the management as such. So here the blue colored image is considered to be the what do you say that the line of treatment or management is planned, whereas yellow colored arrow that is showing the movement of the pathogens from the alimentary canal to what do you say that intracellular compartment. What is being considered as the dhatu paka as per the Ayurveda understanding. Whereas the movement of the pathogens from the intracellular compartment to alimentary canal, what we can say the concept of doshapaka, or otherwise that is also being termed as doshanam shakhat kushtabhigamana. How to identify the Nidana and Samprapti? For that, you have to well versed in the elaborate methodical history taking. That means you have to interact with the patient and you have to get the necessary information to make the diagnosis. After that, you have to do the thorough physical examination. After doing the physical examination, you have to should have the capacity to localize the lesion. After that, you have to identify the probable pathogenesis that is happening inside the human body that has to be planned. After that, you have to identify the dosha and dusha afflicted. Then you have to identify the srotas involved in the pathogenesis. Then along with that, you have to identify what type of srotadusha is happening inside the human body. You should know what about the status of the Agni. is there any presence or absence of ama is present in the body? And you have to identify the actual Roga Marga afflicted in that particular individual that has to be known. So the take-home messages from today's discussion are, whenever you are planning to understand the subject of Roga Nidana, the one word that you have to get mastered is Roga Marga. So when you are planning to understand the Roga Marga, that requires the thorough understanding of the movement of the food as well as pathogens from the alimentary canal to intravascular compartment, from the intravascular compartment to interstitial compartment, from the interstitial compartment to intracellular compartment. To know this particular and understanding, if you are going still much beyond, then you have to have a thorough understanding of Bahya Srotas and Abhyantara Srotas, wherein we are going to identify what is the exact source of entry of the pathogen into the human body, whether is it either natural orifice or unnatural orifices in the form of trauma, etc., or otherwise is there any possibility of the entry of the pathogen into the Abhyantara Srotas. After that, you have to know about the number of pathogens entering into the human body, and later you should know about the virulence of the pathogens entering into the human body and their impact as such. Dear ANA community, that's all for today. What are the major key takeaways from today's discussion? Mention in the comment box below. And what is the one video that you like to discuss in this particular channel? Mention in the comment box below, and spread this particular video to maximum number of true Nidana learners so that we can make a huge movement out of this particular small message. That's all for today. Something more in the next video. Thank you.